Well, hi and good morning to all of you watching. We apologize for the delay in getting you this broadcast. Of course, this is the COVID-19 care conversation brought to you by Hawaii Pacific Health and the Hawaii Executive Collaborative, looking a little bit different today. We have had this long streak, Yanji, of doing this broadcast for a few months now. Today, we ran into some technical issues. So this is actually a taped broadcast that we have going on where we have two very special guests joining us on this Monday.
Yeah, we ran into those technical issues, but we didn't want to deprive you of the conversation that we need to have. We have so many questions, of course, for Governor David Ige, who joins us every Monday. And we also have Gavin Thorton, the Executive Director of the Hawaii Appleseed Center for Law and Economic Justice.
All right, Governor, thank you so much for joining us. We apologize for the technical difficulties, but first off, we want to get an update. We're seeing more and more of these case numbers continue to go up. Yesterday, another high number. What are your overall thoughts about some of these rising case numbers?
Certainly, Ryan, I just want everybody to know that it really demonstrates that we have built the capacity. We have the ability to test and get results back within 24 hours and really follow up in contact tracing. 17 of the cases yesterday, the 27 cases, were a result of following up on a funeral service that occurred. And we were able to get the first case and then followed up on all of those who attended, and then identified the 17 additional persons infected. So just really, it does demonstrate that our system is working, that the ability to test and get results within 24 to 48 hours helps us to identify those who are infected and then get them to isolate and quarantine so they don't infect others.
Well, we have a holiday weekend coming up. What are your concerns? Because we've seen double-digit cases again and again over the last week or so.
I just really, Yanji, would want to remind people that, there is a personal responsibility. We can only be successful if each of us take the responsibility to physical distance, to not interact. More and more we're seeing private gatherings of people where they are meeting for services, church services, or other kinds of activities because they can't meet in the formal church. But that really creates a different kind of issue. They're indoors, they're in close proximity, and we're seeing these clusters of cases because people are meeting in private homes and spreading the virus. So I just want to remind everybody, especially as we go into this long weekend, that they need to keep physical distance. If they are going to gatherings, wear your face coverings. If everyone is wearing a mask, the CDC has said the possibility of transmission is tremendously reduced. So, if you are going to, well, first I would recommend that they not go into social interactions with people, especially they don't know. If they are going to wear their masks and then do everything they can to keep 6 feet apart.
Last week was a big week for you folks as you make the announcement of the lifting of that 14-day travel ban. But with that comes a lot of questions that people have, obviously, about some specific things. A lot of questions that we have and that we're hearing are from local residents that want to go away maybe for a weekend and come back. But, just the logistics of getting a test done while they're away, maybe in California or Las Vegas for 3 days, obviously are going to be unable to get a test. So can you talk us through what that procedure is going to look like and how are you going to be able to track the people that have to come back home to get that test?
Ryan, on a couple of things, and I would just say, if people are asking me whether they should be traveling, especially if you're traveling to California or Arizona or Texas or Florida, I would strongly encourage them not to do it, especially if they're going for leisure reasons. If it's a discretionary test, we are seeing more asymptomatic carriers of the virus, which means that people are infected, but they don't know, they're not sick, they don't have symptoms. And certainly if someone is going into that, especially if they're a high-risk group category, right? So if you're a senior citizen or have multiple, diabetes or hypertension or any of those where you are more greatly affected by the virus, I would certainly recommend that they not travel. Ryan, a couple things, right? I just want to reemphasize with everyone that the 14-day mandatory quarantine will continue. What we are allowing is for those travelers who can complete a test prior to 72 hours prior to getting on the plane to come here, and they get a negative result, that they can come and not be subject to the quarantine. So I really want to make that differentiation, and if you are a local resident and you travel and you can complete the same requirement, which is to get a test and get a negative result prior to coming back, then you can avoid the quarantine. But I really would recommend that they not do it, especially, everybody's going to those areas where the virus is really active. Las Vegas had their highest one-day count in this whole pandemic period. Arizona, California, Texas, and Florida has had their highest counts by far in the last few days. So, traveling to those areas is just not a good idea at this point in time.
Are you confident that there will be enough testing available to meet that 72-hour criteria? One of the concerns after speaking to the lieutenant governor on Friday, as I started to think about it, was, okay, someone gets the test, they don't get a result until, maybe they land or a few days later, and it is positive. Then what? I worry about, will they be able to get it within that threshold so that they don't get on the plane? And if they don't get the result in time and they're here and they have COVID, then what?
Well, certainly, Yanji, and that's why we're seeing, right? I know that there's some that wants it to be, 5 days instead of 3 days. And, we're trying to keep it simple. Yes, we are building the network of partners who will be able to administer the test and is fully aware that, it's 72 hours prior to departure. So someone needs to be able to take a test and get the result back before they depart. If they come here and they don't have a negative COVID test, then they are in quarantine, and that's what will happen to them until we can get that result, if it should follow after the fact.
And so to follow up on that, if they arrive here and they do get their test back and it is negative, do they then, who's I guess monitoring this when they come into the airports? Is it the Department of Health? Is it TSA? Who's going to sort of be monitoring the people that are coming in and making sure that these tests have been approved or that they're going straight into quarantine?
Yeah, so, Ryan, certainly we're working through that, and that's why we're looking for partners, right? We want someone who can give us a presence here in the island so that we can verify that the individual went to this test pharmacy, or, we are talking with CVS so that we can verify that, in fact, they did go to the test and it was a test that we believe is FDA approved. The lab facility that they're using is CLIA certified, so that we know that it's a reliable and accurate test. Those are all the details we're working through. We do know that there is interest in people coming to Hawaii. We just want to make sure that from the residents' perspective, that those who are coming would be subject to the quarantine. If they have taken a test and tested negative prior to 72 hours prior to coming here, then they would not be subject to quarantine. And we do have people right now making phone calls. We have a partnership with the hotels, and so those that are taking travelers who are in quarantine have been working with us. They've instituted procedures at their facilities. They issue a one-time use key only, because the quarantine rules are that you travel from the airport directly to the quarantine site. You go into your room and you're required to stay in your room for 14 days, and you cannot leave for any reason. And the hotels have been working with us to implement those rules. And we will continue to work and follow up with phone calls and other actions. As you know, we have arrested both travelers and local residents who've returned and have violated the quarantine. And so we are serious about following up to the extent that we can as provided by law.
You know, so far we've had, you know, a few hundred people coming in, but if we really open the floodgates, if you will, with allowing the testing and more people start to come, for those who decide not to get that testing, there had been some talk about ankle monitors and things like that. Are there any further steps that can be taken to ensure that these folks are in quarantine? Because while they're, you know, the phone calls and things like that obviously are helpful, if we have thousands of people coming in, it'll certainly be hard to keep track of all of them.
You know, certainly, Yanji, and I think so. Part of this pre-testing program will engage the facilities, the hotels. You know, they have to be partners. We can't do it just by law enforcement, or we can't do it just with people making phone calls. It really does have to be a comprehensive program so that we can identify and take action against those who choose to violate the quarantine.
We know that you have to go, and we appreciate your abbreviated time here with our program. But just one final question that I had, you know,
Ryan, we can probably go a couple minutes over.
Okay, great. Great, thank you.
We'll take it.
That. Well, then let's talk about the legislature a little bit. Of course, we know that the session is going on right now. There were some direct bills and things that were passed that will help to provide relief to residents. Can you give us a little summary about what some of those efforts are happening in the legislature, and what are some of the things that you are hoping that they continue to do, support some of the initiatives to help people out of this pandemic?
You know, certainly there's been a number of efforts to provide additional support to those who continue to be unemployed. So the legislature had passed the measure to provide $100 per week additional once the federal dollars dries up. So that would provide some further assistance. It's not as generous as what the federal government provided, but I have talked with many employers who say that their employees are reluctant to get off of unemployment because the benefit provided, when you add the state benefit and the federal benefit, they make more money than they do actually working full time. So, you know, we do believe that the reduced benefit would be helpful to them, but wouldn't be an incentive to keep them on the unemployment route. There's also help with food distribution. You know, the counties are doing a lot of food distribution to those who are food insecure, and the legislature did provide additional funds to do that. There was grants to childcare providers. I know that I've heard from many of the current providers that the increased sanitation cleaning requirements has increased the cost to operate these programs and making it difficult for them to stay in business. So definitely want to be helping childcare providers. They've also provided additional funds for personal protective equipment. You know, everybody's changing what they do, and we know that anyone who has contact with general public would be exposed to the virus. And so legislature provided additional funds to allow us to support a broader range of businesses and organizations that have had a difficult time, especially because of the shortage of PPE all around the world, so that the state can acquire and help to facilitate distribution, especially to those organizations that normally would not have gotten PPE for their employees. So those are a couple of the highlights, Ryan. I know that there might be a few other things, but I forget all of the different appropriations made.
I want to go back and ask one quick question on the travel quarantine, the changes. There were a lot of questions when we had the Lieutenant Governor on about families and about the requirements for children. What are your thoughts on that? Should it be 2 years old, like in some countries? Should it be 12 years old? What do you think is the threshold? And when do you plan to announce that decision?
You know, certainly, Yanji, right now we're just saying everyone needs to get tested. But obviously, I've asked Dr. Park and Dr. Anderson to really give us a recommendation from the public health perspective. The CDC has been silent on that, and I know that when we have a family cluster, we do test everyone in the household. So we're kind of working through the details with the professionals to really find out what's appropriate in terms of testing. We do know that CVS, and we've had some conversations with them, have said that they would not test children. So, once again, it's kind of the balancing act. We want to be able to provide a broad range of people who can administer the test. They need to be in every market that we are hoping to bring visitors from. But we want to be able to verify, we want to make sure that those who are coming into our state are negative for COVID, at least at that point in time, so that we can assure the public that bringing these visitors does not increase the health and safety of our community.
It sounds like so many moving parts. Do you really think that this is going to be up and running by August 1st?
Certainly, we are working very hard, Yanji. There's a lot of people committed to doing their part. We have 5 task teams that are working on the various components. There's a group that is working to get the digital application up and running for both the pre-testing as well as the existing quarantine. We do have people looking at all of the logistics at the airport. I know that if you've traveled, we've had to change the flow of the passengers exiting planes. We will be putting in the thermal screening. There's a pilot there right now. We hope to be selecting the vendor and implementing those. So, definitely we have many people who are working to make this happen. We know that this pre-testing program is really an effort to bring trans-Pacific travelers, because we know that so many states have not done a terrific job of managing the virus, but those who can get a test and be negative prior to coming here at least allows us to bring a traveler, and the risk to our community is contained.
All right, Governor Ige. Well, we thank you for your time here this morning, and for every morning. We've been lucky enough to be able to spend our Monday morning starting off our week with you. We're going to take a little bit of break, but we will see you back in the later part of July. So thank you again for allowing us the opportunity to speak with you and bring you some of the questions from our viewers.
Yeah, thank you so much, Brian and Yanji, for including me in this. I do look forward to these sessions because it gives me the opportunity to really hear the questions and respond directly. So thank you so much for everything both of you do for our communities.
Well, thank you.
Thank
We'll
you.
see you later next month. And there you have it.
A lot of moving parts. When you think about all the possible scenarios, and after our conversation with the Lieutenant Governor, I did start to think, well, what about this? And what about this? And I know that there are greater minds at work, but still, August 1st is going to be here soon.
That's right. And another thing that, of course, is coming up is just the payment of rent. And we know that has been an issue for so many people in just trying to find ways in which they can pay the bills. And we actually have another guest joining us right now.
That's right. Gavin Thorton, the executive director of the Hawaii Appleseed Center for Law and Economic Justice, is joining us. Thank you so much for being here. We really appreciate it. Your being here is also part of our partnership with Hawaii Data Collaborative. They've been kind enough to give us some great information. Your video is a little fuzzy, but we know that the content is going to be great. I don't know if that's just my camera or
that's just, I haven't had my COVID makeover.
Oh, I like that. I like that.
It.
But let's get right to it. The legislature did some quick work last week, and we want to specifically talk to you about the Housing Relief and Resiliency Program. Before we get into the nitty-gritty of that program, tell us about some of the economic challenges that families are facing when it comes to rent and mortgage, thanks to COVID-19.
Sure. Well, first of all, thank you so much for having me. Wonderful to get to talk to folks here. So before we entered the pandemic, Hawaii families were already struggling. You had on your program last week someone from Aloha United Way who was talking about how the Alice report, how there were so many working families, nearly half of residents in Hawaii were struggling to make ends meet. They don't earn enough to pay for a basic needs budget, like the minimal things that they need to survive here in Hawaii. That was before the pandemic. And since then, things have gotten so much worse for folks. You know, we had half the population kind of teetering on the financial brink of disaster. In normal times, you have a few people falling off that cliff, few people climbing up it. With the pandemic hitting and our high unemployment rates, a bunch of people got pushed off at once. So now we're looking at close to 60% of Hawaii's households struggling to make ends meet. And they're struggling to meet those most basic needs. That's things like, you know, food, I guess water people have covered, but shelter, food, water, and shelter. Those are the things you need to survive. And the food and shelter pieces are going to be really hard for folks to cover right now.
Talk to us a little bit about this whole initiative or the Housing Relief and Resiliency Program. How will that specifically help, and what are some of the details behind this program?
So Governor Ige just spoke about some of the legislative initiatives that have recently been passed. There's actually a bill on his desk right now that appropriates the federal CARES Act pandemic relief funding that came into the state. $100 million have been appropriated for rental assistance and for housing counseling. So that's a huge number, but it's reflective of the huge need that we're anticipating. The UHERO, University of Hawaii's Economic Research Organization, did an analysis of how many people are likely to be affected. It's around 40,000, 45,000 households. The Data Collaborative did a look as well. And also we have a Hawaii Budget and Policy Center that's housed at Appleseed. All three of those entities estimated that we would need about $100 million to help bridge the gap between what people were paying for rent and what they could afford and what they can't now after they've lost their jobs because of the pandemic.
So what will this actually look like for working families? How will they be able to get the money? How much money are they eligible for? And then for homeowners, what kind of mortgage, I guess it's counseling as opposed to pure assistance, but what kind of resources can they expect?
Right. So, on the rental assistance side, actually, for the whole scheme, the rental assistance, the housing counseling, there's a recognition here that our housing in Hawaii is an ecosystem. And so we have people that are paying their mortgage, that are homeowners, we have renters, we have landlords of those renters. If the renters are unable to pay their rent, then the landlords are going to be unable to pay their mortgage, and the whole housing ecosystem is adversely affected. For the homeowners, they need to be able to pay their mortgage, otherwise they're at risk of foreclosure. But they have a couple advantages over renters. One of those advantages is that there's been action at the federal level that provides forbearance on their loans for essentially up to a year if their home is covered by a federally backed mortgage. That's about 60% of people in Hawaii. For the folks that don't have a federally backed mortgage, they have a different lender. Often those lenders are going to be a lot more willing to work with them and just say, okay, you can't pay now. Let's tack those payments on to the end of your mortgage and you can pick them up later. Renters don't have that luxury. They need to be able to pay the rent now. So this rental relief that's been passed by the legislature would provide up to $500 per month for a household that's lost their income for up to 5 months. So potentially $2,500 to help pay the rent.
Yeah, it's got to be, welcome news for those people who are struggling. And I think overall, I mean, we were talking offline before this, but it really is about sort of just getting money back into the hands of the people that need it the most, right? And being able to support directly these residents and being able then to support these tenants and these landlords. Can you speak to the importance of that and being able to infuse some of those dollars and that CARES Act money and the impact that it's going to make directly with people?
Yeah. I mean, as I mentioned earlier, like housing is one of people's most basic needs. And if you can't pay your rent, then you get evicted. And if you're evicted, then you're on the streets. And if you're on the streets, it costs society, it costs our government a whole lot more to care for folks. Homeless shelters are pretty expensive. Treating people on the streets, treating the after effects of the trauma is really expensive. Not to mention, I mean, the obvious human costs of going through that experience. We want to avoid that as much as possible. So getting money to people to ensure that they can remain in their home during this very difficult time that so many people are facing is absolutely critical. And that's why we're really pleased with the rental assistance portion of the bill. Another good feature of what the legislature has passed is what Governor Ige mentioned just a few minutes ago. Previously, and actually right now it's still happening, the federal government is providing a boost of $600 every week for people on unemployment, an additional $600. That's huge. It's why we haven't seen a tidal wave of evictions. It's why we haven't seen a real economic disaster so far, but that's ending at the end of July. So come August 1st, we're going to be in trouble. That's when this rental assistance is going to kick in. And that's when the $100 a week boost that is going to be state funded for the unemployment benefits, that's going to kick in then too. It's a big hit. It's a loss of almost $2,000 a month for people. But it's still something. It's significant. You put that money into people's pockets, they're going to spend it in the local economy to survive, and that's going to help us all.
People who are watching are going to want to know how they can actually apply for this assistance. I know that the details are still being worked out. The governor hasn't actually signed it yet, but how can people learn more if they have identified themselves as someone who will need this help?
Yeah, I guess I would say this is going to be a key part of all this, is ensuring that people know about the opportunity to get this relief. I suspect that 211 is going to be a very important resource. You heard last week their call volume has gone up by 600%. I'm almost a little hesitant to mention 211 because of that huge call volume. But I suspect that that's going to be one of the key links to getting people to this program. We really don't know. People are running very quickly to try and get this program up and running by August 1st. But I think a big part of that will be a push just to make sure that people understand where they can go for help.
All right. Well, we look forward to getting more information. A lot of things happening August 1st. It's a big deadline for the state reopening and this added support as well. So, Gavin Thornton, we thank you for joining us here this morning, sharing with us that important information that really is important to get out to the community. We apologize for the technical difficulties, but thank you for sticking with us and for being here with us this morning.
Well, thanks so much. Appreciate
Aloha.
it. Aloha.
Ryan, that is going to be a tremendous resource for so many people. $500, bridging that gap that he was talking about. And, on the homeowner side, a lot of people don't know how to navigate this. And so that will also be very important to know that you and your lender are speaking the same language, that you have resources on your side, that you understand whatever you're signing or whatever agreement that you're making. So this will be so critical. The legislature working pretty quickly to get that through on Friday, just waiting the governor's signature, and already programs trying to figure out how they can actually hand out the money. One important thing is that the money is not going to go to individuals. It's going to go directly to landlords. So there will be a way to trace all this money as well.
Yeah, and it's no doubt just great news for these people who are in need of this financial support. We are hearing from other states that have chosen not to go down this route, where they're not using the CARES Act money directly for programs such as this. And so, a lot of local residents, obviously Hawaii, the cost of living is very high, and a lot of people will rely on some of those additional support, especially for housing. So it's welcome news for those people. And again, we will try to get you as much information through that once all of these things are sort of fleshed out and the details are sort of determined as we head towards that elusive August 1st deadline, where a lot of things will be happening on that date.
Yeah, we apologize that we can't have the typical back and forth that we have with you. We tried to anticipate as many of your questions as possible. We've been having these conversations that we can kind of guess what you're going to be asking, but nothing beats the real thing. We should have this all ironed out by tomorrow, but we definitely wanted to get the governor while he was available, and he is a very, very busy man. And we also appreciate Gavin Thorton for joining us. Thanks to the Hawaii Data Collaborative. They're doing amazing work. Both of those organizations, the one that he represents and the Data Collaborative, and you should check them both out because there's a lot more resources that they have. Before we go, of course, we always like to highlight a Hawaii hero. And Ryan, this one is one that helps young people.
That's why we're highlighting, of course, an organization that has been around for a few years now and really focusing on the future. The Center of Tomorrow's Leaders works with Hawaii high school students on Oahu, Hawaii Island, and Lanai. CTL, as they're known, they're coordinating leadership and internship opportunities for young adults by connecting them directly with organizations and programs responding to the impact of COVID-19 across the state. And the programs benefit students with post-high school experience and also those benefit organizations who are in decline of volunteering contributions because of the social distancing measures. So CTL, of course, supported by the Hawaii Community Foundation's Resiliency Fund, and they are continuing to do great work in mentoring tomorrow's leaders despite all the challenges that are happening. So great to see them continuing to help to provide that support for our next generation of leaders here in Hawaii.
Yeah, and Ryan mentioned Hawaii Community Foundation's Resilience Fund. That's been such a key component of the recovery that is continuing to go on as we navigate this pandemic, and that's through the Hawaii Community Foundation. And we are going to be speaking tomorrow to Micah Kane, who runs that organization, and he's going to be talking about all the different people who have been coming to him for help and how they're able to figure out where to put the resources that they have. We're very interested to talk to him because we hear sort of on a broad basis, people need money for housing, they need food, they need, whatever it is they need, but he will have a much better idea of where the needs are and how we can do this together.
Yeah, looking forward to talking to him and just hearing how really the community has come together in this time and how they have been such a key part in all of this. So we look forward to that conversation, and it will actually be our last conversation that we have as part of this program. We'll have more information tomorrow about everything that's happening with the way that this program looks and how you can continue to stay connected with us. But of course, we want to thank our sponsors, the Hawaii Executive Collaborative and Hawaii Pacific Health, for bringing us this conversation a little bit different here today, obviously. But we thank you for your patience, for everyone sticking in, and we will see you right back here tomorrow.
Aloha. Yeah, see you at 10:30.